Good evening. My name is Dr. John Littell. I'm coming to you after a long day at work to just give you an update on some developments with COVID-19 that have been very disturbing to a lot of folks out there, and actually have come under a little bit of criticism for some folks think downplaying the impact of COVID-19 on our children. And that's what I'm going to spend at least a few minutes talking about today, and we'll see if I can get that all done. Now, first of all, before I get into this a bit more, I want to let you know that the name that the World Health Organization is using for this virus seems to continually evolve, as viruses do. So, essentially, we were calling this coronavirus, and many of you still do. I learned about coronavirus in the 1980s in medical school. It's a common cold virus. It's an RNA strand virus. These particular more deadly coronaviruses, MERS and SARS and now COVID-19, are animal cold viruses, for lack of a better word, coronaviruses that have gotten into the human population. Most of you had heard that, and then of course you come across the name COVID-19, which is Coronavirus Disease 2019, COVID-19. At the same time, another organization around the world was calling this SARS-2 coronavirus, SARS-CoV-2, SARS-CoV-2. Very complicated. The reason the World Health Organization didn't use that is because they didn't want to scare those who had to endure SARS-1, which came out about 10 years ago and did kill a number of people in Asia. So they wanted to get away from the SARS word and use COVID-19. Actually, I do as well. So I'm sticking to COVID-19. So let's put that down for now. We're going to talk about the impact of COVID-19 on our children in light of the recent news out of particularly New York City for our country, but prior to that out of Italy, Northern Italy, and the United Kingdom, with reports in the Lancet, the British Medical Journal, and in an Italian medical journal describing anywhere from 12 to 50 children who had a reversible illness. Again, they got better. To my recollection, none died. There might have been one tragic death in Italy. But this disease had similar features, if not all the features, of a well-known disease called Kawasaki's disease, which was originally defined in Japan many years ago, hence the name Kawasaki. And we've all been familiar with that since medical school. It's an immune response, meaning that the antibodies go haywire inside the child. In this case, a delayed response to what's called an antigen, a protein that's usually the virus that's getting throughout the entire body and triggering a host of reactions, such as swelling in the hands and the feet, a red rash called vasculitis, where the vessels get inflamed, swelling and peeling of the lips, redness of the eyes. It's actually in many ways similar to measles when it first presents. And another condition that I have treated called Hennig-Schönlein purpura, named after some German researchers. The important thing about Kawasaki's disease, and now this Kawasaki-related disease, is for the most part, it's a reversible self-limited condition. Yes, there are cases that go on to long-term cardiac or heart issues. But what we're seeing in these pockets, these hot pockets, New York City, Northern Italy, and parts of the UK, is that these children, some have had to go into the hospital, some have had to receive aggressive therapies, virtually all have recovered. And the numbers we're talking about are at the very most in the dozens of children. Compare that to the almost 1,000 children who died in our country alone from H1N1 in 2009. Or the 180 children who died this year alone from influenza. And of course, they come around and say, oh, these were children, many of whom had immune problems, asthma, or other health issues. Well, we don't know the facts yet about these children. So I would ask you, before you start thinking that I am wrong to say our children won't be affected by this COVID-19, look at the facts about where it's occurring and the actual numbers of children. You know, for a reporter out of New York City to say this is the tip of the iceberg, I believe that's fallacious reasoning and probably yellow journalism, to use an old term. Now, again, the death of any child, is something that we all just don't want to tolerate. I lost a 5-year-old niece from an aneurysm. I lost a brother from a drunk driver, and I've had many patients die from tragic illnesses, drownings, leukemia. So please don't look at me and think somehow I'm minimizing COVID-19 for your child. I'm just asking, if you have a child in Ocala, Florida, Davenport, Iowa, Oshkosh, Wisconsin, Baker, Montana, Geneseo, New York, do you need to really worry that this child is going to get COVID-19 or this delayed immune response to COVID-19? When in fact, even the Centers for Disease Control has stated in the case definition that there needs to have been contact with a person with COVID-19 within 4 weeks or positive laboratory identification of COVID-19 in the child. But we all know, and you've seen my previous videos, you do not get COVID-19 from the atmosphere. You don't get COVID-19 from just running around a playground, playing soccer, basketball, or going to school. There's been no reported cases of transmission in those settings. All right? We know, if you look at the data out of Italy, out of China, out of New York City, that the transmission of COVID-19 has almost exclusively been in the healthcare environment, which is why the Italian doctors said, please don't let people come to the hospitals, treat them at home, all right? Or in the nursing homes. That's been several of my patients that have gotten infected in the nursing homes and the hospitals, or in the homes of patients where people have been actively infected. And that includes these children in New York City and Northern Italy. And what's to say we couldn't have prevented this disease also? That's another whole talk. So I want to let you know that I am not downplaying this disease in any child. I'm asking you to consider why this, what I believe to be a rational response from the CDC, which is telling us that when the schools open next year, and I'm finding that right now, when the schools open next year, the guidelines from the CDC state that even in the least affected parts of our nation, we should be keeping everybody away from each other in our schools. Close all communal spaces, cafeterias, dining halls, and playgrounds in our schools. What is recess going to be for my 11-year-old son? All right? Not allowing children to play with each other, even in Oshkosh, Wisconsin, or Elmira, New York, or here in Florida, or anywhere that's not been affected to anywhere near the degree that we've seen in some of the hot spots. And again, not in the last month. All right, so I'm asking you that when you look at these CDC recommendations, and you see doctors who are saying put masks on, and other people have been so upset at me, oh, Dr. Littell, you know, my doctor's wearing masks with every patient encounter, and he's having everybody wear masks. Well, I'm sorry. All right, I am sorry. I don't agree with that doctor in this town anyway. All right, and even at this time in our nation where we've gone off the cliff, we're way off even the plateau for COVID-19 illnesses, not cases. Please go back to my last video. Cases mean squat. A case is not even a sick person. It's a person who's got immunity that's showing up in the serological testing. I might have a case for all I know if I get the blood work. I've never been sick. I've never been contagious. All right, I don't need to wear the mask. We need to realize the other driving train behind this, and please don't call me anti-vax, but the industry will make a bundle off of the mandatory vaccine if it comes down this way for our nation. If they scare every parent in this country enough to fear for their child, they're going to say, get a vaccine for every child. And I'm going to tell you, that's not the way to go. I'm not anti-vaccine, but I'm for patients making informed decisions about their children with regards to any intervention, and that includes vaccines, many of which, as I said in the last segment, have not been helpful. So, on that note, look at the history of hepatitis B vaccine. Look at the history of HPV vaccine, which I do discuss in my book, that I make 25 cents a copy if you buy it, okay? But I discuss that. All right, HPV vaccine is a vaccine that came out because they made an assumption that every child would get a sexually transmitted disease in his or her lifetime. That's reversible, by the way, once you identify it. So I'm just telling you, when the CDC makes a recommendation, it's not always based on what's right for your child. Others, such as labs and pharmaceutical companies, will also gain from our fear and these quick decisions to get lab testing for every child and administer drugs or get vaccines for every child. So again, in my last few seconds with you, I'm imploring you to try to get as much factual information as you can. I get a lot of this on the internet. It's getting harder and harder to look up facts like pediatric deaths from COVID or pediatric deaths from H1N1 or measles or any other infectious disease. But you can do it, and if not, just remember we have to consider the social, the mental, the emotional, and the physical well-being of all of our children at these times. And telling our children to wear masks to church and to school and to restaurants is not good for their mental well-being. It's not good. Check out my first video. So again, I ask you, how is COVID-19 impacting our children? How will it impact your child? Consider the facts. Don't be afraid. And please, trust me. And if I'm wrong, I'll come back and I'll apologize lickety-split. But I know in my heart, and I know based on my training at Cornell and Columbia and George Washington and my years in the Army and as a family doctor and as a father of 5 children, I know in my heart that these children do not need to be wearing masks. And you don't need to worry about COVID-19 or MIS-C in your child at this point in time, with very few exceptions, as I've stated. All right? I'll follow this up. God bless you. Have a wonderful evening. Thank you for listening.